Hi, I'm Penelope Edwins. I'm a neuropsychologist. Well, I started this channel in the hope to be able to equip you with knowledge on how to, one, identify mental health disorders, two, to be able to access information on what they are, and then three, to also know or understand who the mental health professionals are. They can assist with each disorder. With this channel, my main hope has been to assist you in any way I possibly can to help you in finding out about mental health disorders, but also just to advocate, to urge you to advocate for your own mental well-being. Be your own advocate. Do the research that's necessary to find out all the information you can possibly can get on the disorder that you are struggling with or the disorder that you've been diagnosed with. For example, when somebody gives you a diagnosis, it's imperative to look it up. Look at the medication you've been prescribed. Look to see whether it matches the symptoms that you encounter, because ultimately you are the one that understands and knows what you go through better than your therapist, better than your psychologist, better than your doctor. You're the one that will be able to describe the symptoms best. You'll be the one because you are the one that experiences the symptoms. Therefore, please, I urge you, look out for the medication that you've been prescribed, compare it to the symptoms that you struggle with, and look to see that it actually does really treat the symptoms or minimize or aims to minimize the symptoms that you. So, what constitutes a mental disorder? When does a condition require for us to seek help from a mental health professional? And who are the mental health professionals, and where do we find them when we're looking for one? Well, a mental disorder is a condition that's so debilitating that it causes so much distress that it affects your occupational, your social functioning to a point where you are unable to continue your life. So when it's that debilitating, it means that you need to seek help from a mental health professional. Well, and who are these mental health professionals? Where do we go for help? Well, let's start with the doctors. The doctors. A neurosurgeon is a medical doctor who gives both surgical and non-surgical treatments pertaining to the nervous central system, meaning the brain and the spinal cord. So, a neurosurgeon, for example, will be able to operate on your brain if you have tumors, to be able to relieve swelling, edema in your brain or swelling, and be able to stop hemorrhaging, for example, in cases where you have bleeding in the brain. They're able to operate and address such issues. The next is but neurologists are often mistaken for neurosurgeons, or the differences between the two are often a little bit blurry. Well, a neurologist does not do surgical treatment or offer surgical treatments. A neurologist treats conditions or conditions that constitute dysfunction in the central nervous system, or particularly to do with nerves and the brain. However, those are conditions that they don't require surgical intervention. For example, multiple sclerosis, Parkinson's disease, where there's mobility difficulties, stiff man syndrome, or epilepsy, even headaches. Neurologists are able to locate the origin of the condition and able to treat those conditions, or able to explain the causes of those conditions. And next is a psychiatrist. A psychiatrist is a medical doctor who specialized in psychiatry or psychiatric disorders, meaning that they are able to differentiate whether a condition or an illness is psychiatric or physiological or a combination of both. They are also able to prescribe medication in their treatments. So they would be able to give you medication for your condition And then they would refer you to a clinical psychologist to do the management of their particular condition, or then refer to another medical doctor, depending on what the diagnosis is. So, clinical psychologists, particularly when it pertains to the mental health field, clinical psychologists are the ones that take care of you on an ongoing basis, meaning that they will address the condition, equip you with coping skills for your particular condition. Those are the people that you would see on an ongoing basis for treatment. Often on a weekly basis, twice a weekly basis, they will look after you and be able to maintain that condition. Clinical psychologists will also treat ongoing conditions such as eating disorders, for example, personality disorders, um, conditions that require constant care and constant management, people that you can rely on to continue supporting you with conditions that are debilitating. Often this is due to acquired brain injuries, traumatic brain injuries, neurodevelopmental, neurodegenerative disorders that cause the cognitive impairments, as in neurodegenerative disorders, as in Alzheimer's or old age disorders, Parkinson's disease as well, and also neurodevelopmental disorders such as ADHD, autism, dyslexia. We try to look at what the role of the brain is and how brain chemistry sort of affects the functioning, cognitive functioning, and behavioral functioning, or as a cause of to explain impairments or dysfunction in those disorders. And then we have educational psychologists. They assess cognitive, academic, as well as emotional functioning in children, or just the child's school readiness abilities. So, is a child ready for school? In which case, they would then enhance the child's skills to be prepared for school or for starting school, in that matter, or coping with school. And then we have child psychologists. They shouldn't be mistaken with educational psychologists. Yes, they both work with children. However, child psychologists would address children and adolescents' emotional, psychological, social difficulties and help them navigate their interactions with the world around them, with their peers, with their parents, with their teachers, with their school environments. Yes, but on a more on an individual basis and more on an emotional and psychological basis than an educational psychologist would do. And then we have industrial psychologists. These are psychologists who give direction to patients who have had to change their occupation direction due to injuries or due to psychological impairments of sorts, and then they need a new direction in terms of what occupation they would be capable of conducting or undertaking, and these psychologists often help in that regard. And in that same field, you'll be able to find psychometrists who are the ones that actually assess cognitive abilities and are able to match it also with the industrial psychologists with and the able to match the patient's abilities and occupational um, capabilities with the correct occupation. We also have speech therapists. Speech therapists often help with remedying or correcting speech defects that often arise from injuries to the brain, etc., and where patients often struggle with their speech, and they try to rehabilitate the patients in the best way that they can so that they're able to communicate better. Particularly, you would see that in patients who've suffered from strokes or traumatic brain injuries, and certain parts of the brain have been injured that control speech and language, and they would struggle with uttering words or self expression, and they're just unable to find the correct words when they express themselves or when trying to express themselves. We also have other professionals like social workers and life coaches, counselors who we value very much in this field that make a huge difference, particularly with long-term care of patients who need somebody just to talk to or somebody just to talk about life, who don't necessarily have a particular issue. They just need some guidance and somebody to just assist them with better perspective on life. Now, having understood all of this, I urge you to do your research, particularly with your condition. Make sure that you have the correct diagnosis firstly, and then seek out the correct mental health professional to treat your condition. And remember, mental health professionals also specialize in what interests them. So while a clinical psychologist, for example, one could be good at behavioral therapy, such as cognitive behavioral therapy or dialectical behavioral therapy. Some psychologists, for example, specialize in particular areas of interest to them. So they may employ different methods of treatment, different methods that they find interesting or impactful when treating patients. So find one that works best with your particular condition, that's able to alleviate your symptoms and able to make a difference in your suffering or in the condition that you are struggling with. And if you are unable to get or make any progress with that particular psychologist, go and find another one that will be much more or better well matched with your particular circumstances. And please understand your own condition as well, so you are able to describe the symptoms to the mental health professional. That way, it will be you have a much more effective way of working together to eliminate the symptoms and to be able to reach better treatment for your condition. So please research your condition, equip yourself with enough knowledge about the condition, and then seek out the correct mental health professional. And I hope this has informed you or provided enough information and is somewhere that you can go to conduct some of your research with regards to your mental health